Reversible. So exercises with reversible muscle action. So think of plyometric, shortening cycle, where you have an eccentric muscle action immediately followed by a concentric muscle action, right? So in reversible muscle action exercises, a muscle group is stretched immediately before shortening. So you're gonna have that stretch shortening cycle, your muscle spindles, your GTOs, okay, all involved in this. So you're gonna have the muscle spindles activated because when our muscle is stretched rapidly, we want to contract it. So we're gonna have an inhibition of the GTOs. We're gonna have an increase of potentiation. Well, potentially we have more ATP availability, more calcium release, and be able to increase that force production, which elevates the ground reaction force and hopefully propels us higher into the air and have a greater vertical jump, for example, in this example here. However, timing with this is very individualized. If you're looking at PAP, for example, timing is highly individualized. For instance, if someone has a higher relative strength, they might potentially at a faster rate than someone who has a lower relative strength. There's a number of caveats in that. Is there injury related to this? We'll go back to plyometrics. Is your athlete ready for stretch shortening cycle activities? If not, then we should avoid this reversible training effect. Okay, so we have to develop that foundation. We have to establish a strength base first. Again, in order to be powerful, we must be strong first. So we have to go through 1 to 2 mesocycles, 6 to 8 weeks before we introduce our plyometrics. Train each week or 2, depending on the person. Again, individual intensity, although plyometrics should be done at 100% effort, technique is key. Vary mass or velocity. So if you're going to load, for example, in this picture, you're going to load the person with an external load, it may need to be different based on the individual that you are working with. It depends. It doesn't always mean everyone can lift the same amount of weight as the next. A swing, for example, exercise for training reversible muscle action is landing and takeoff. So as they come in and swing, right, they're coming into that block here, and they're immediately going into a lengthening and immediately pushing off to push them out farther and higher. If you have that immediate effect, just like a rubber band, if you push off quickly and rapidly, ideally you're going to swing back farther and higher. Rather, if you stop, squat, push, it's not going to go as high potentially as if you were to go swing in and push off, swing in and immediately push off, and then hopefully get up higher each and every time. So sport exercise with added resistance, so speed resistance training. So some examples of this would be uphill running, parachute running, weighted vests, change in size potentially, overspeed, suspension. There are a number of things that we can do to include for the sport event to be performed in a given resistance and also a given velocity. So there is resistance against direction. Resistance should be, again, maintain technique. If technique is broken down during the use of these type of equipments, you need to back off the equipment and focus on technique. There's no point in adding resistance when technique is broken down. We are then training broken technique, which will get transferred over to the field. Broken technique increases the risk of injury, shortening the athlete's career. So extra resistance should be provided in the direction of propulsion. So for instance, in the locomotion in an anterior direction, it should not be provided in a backward direction. The resistance should also not be too much for that individual. Again, this should still be a progression. For instance, for swimmers from the textbooks on 120, page 129, it's provided swimmers tow bulky objects. Their bodies tend to assume a vertical orientation. If this happens, the resistance is too large and should be decreased. Okay. So when introducing this, biomechanics may be altered. So you need to pay attention to this. You also have overspeed in suspension, where you're being towed from the front. And there's also some new literature for overspeed if weight is actually taken away from you. Now, this might have to be done in a laboratory where you are in a vest and you're able to pull weight away. And you will have to jump with an overspeed. So for instance, if you weighed 100 pounds and we took 30% of your body weight away, you're jumping at 70%. This can also be implemented as in the weight room by using the long resistance bands, throwing it over the bar, putting it underneath your armpits and jumping, right? Now, depending on the thickness of that resistance is going to be in the amount of weight that's taken away. Okay, so that's another way to implement that into your program. So experimental methods, of course, again, these are experimental, but EMS and vibration, where you activate fast twitch. So EMS in addition to, not instead of. So this, if you have access to it, that's amazing. But again, this is not instead of training. This is in addition to. So muscles may be trained here. We're trying to activate the muscles, but it's not activating the neural sides, the central nervous system to the peripheral, connecting those neurons. So we want to make sure we're still training the connection between the central and the peripheral nervous system. Second one is the vibration, tiny oscillations. So exercise on the platform or just standing on it may or may not enhance shortening cycle. Literature is mixed out there, but again, this is highly individualized. Some people feel that it works for them. Other people don't feel a thing. And lastly, we have breathing. Breathing, although when we first start out, we just tell our athlete to breathe. That is key, breathe. We don't want them to hold their breath, especially as a novice lifter. Okay. When we hold our breath, we're closing the glottis, which increases our heart rate, increases our blood pressure, increases the stroke volume and the cardiac output. And it can be very, it can be a safety hazard if you don't know how to do it or you're not used to doing it. So a couple of things. If you are implementing the Valsalva maneuver, this should be done for experienced lifters only. It should be done for very short periods, for only a few exercises at very near maximal lift. Take a half breath. We have that forced expiration, never for beginners. So inhale during eccentric, exhale during concentric. That is key. But again, for our beginners, we just want them and remind them to breathe.